Deepak, can you tell me if if it stabilizes the participants coming in, then we can begin.
Okay.
I'm not able to find the link. Can you share the link directly if possible? If not, it's fine.
Asmita, on Zoom only it says view
One minute,
stream on YouTube.
I'll give the link.
Yeah, I can also give the link.
Oh yeah, I just saw that. Thanks.
The link is here.
Yeah, got it. Thanks.
2 days ago. Acha.
Yeah, click this link. Madam, I sent the link. Yeah,
You have sent 2 links. Which one? Upper one, lower one?
yeah, live started in YouTube. Okay.
Both will work. Sir. Both are same. Everyone is same.
I think we will start now. Deepak, is that okay?
Yeah, we can start now. Okay, I'll remove the waiting room. Then they can directly join from here.
Ranu, is it fine to begin now?
So you're going to introduce
I'll
the...
introduce. So welcome everybody, and I'm so happy to welcome you to the platform of the 8th National Bioethics Conference. So this is a conference which happens of the health, ethics, public health activist bodies once every 2 years, and we are in the 8th platform, and we are in its post-conference event. The conference is organized by the Forum for Medical Ethics Society and the Yenepoya University, and Dr. Uma Kulkarni is there here with us from Yenepoya University, and Dr. Sunita Bandewar is also here from the Forum for Medical Ethics Society. So together we are doing this conference. I'm also a member of the Forum for Medical Ethics Society, so I'm taking this liberty to introduce the platform. And the focus this time was crisis within crisis, the scientific, ethical, and humanitarian challenges of COVID-19. And today's topic, so OXfam India is doing this post-conference webinar, and we'll begin shortly. Today's topic is age of marriage, age of motherhood, and maternal health, right concerns, wrong solutions. So I will ask Ranu, I'm going to welcome Ranu Bhogal, who is the director at OXfam India. She looks after the policy, research, and campaigns, and all the thematic areas of OXfam India. So I'll briefly introduce Ranu, and then I will request her to take over as the chairperson for today's discussion. So Ranu has more than 30 years of experience in the development sector, and in OXfam India, she's been with the senior leadership team for a number of years now. She also has experience of leadership positions in Aga Khan Foundation, UNDP, and her work experience also spans the grassroots. She has done intensive grassroots work in Odisha, Gujarat, Madhya Pradesh, and Chhattisgarh. Economic rights, and that has been a specialized area for her. And at OXfam India, she has played a key role in developing our new strategy, which begins in 2021. And she also leads all the thematic units of OXfam India. Recently, she was included as one of the 50 women leaders in the Women's Leadership in Development Sector commissioned by the Rockefeller Foundation. So welcome, Ranu, and I would request her to chair this.
Thank you. Amita, are you also going to talk about the ground rules, or that will be afterwards, about people asking
No, yes,
questions?
thank you very
Yeah,
much.
yeah,
I think I should just talk about the flow of events.
yeah.
Thank you, Ranu, for reminding me. So the flow of events will be in this manner that in the beginning, all the participants are going to be mute, so you will not be able to talk. But towards the end, we have a question and answer session. So Ranu will introduce the speakers one by one, and we will uh, give 15 minutes to each speaker to talk. And then once all the talks are over, and in between you can write your questions in the chat box, and we'll collect all the questions and pass it on. We'll collect them, and then we'll verbally actually ask those questions to the panelists that you indicate. So it will be good if you indicate whom you want to direct your questions to. And then towards the end, we have half an hour for the question and answers. And if time permits, we'll also take live questions. And you cannot talk in between, but you can always write if you have any concerns in the chat box. This is the broad flow of the event. Anything you would like to add, Ranu?
No, we are good.
Otherwise,
Yeah, so let's start. Thank you very much, Amita, for and a very, very warm welcome to all of you, all the panelists. And now I can see there are 70 participants, and excluding the panelists and myself and the team from OXfam India, I think that's a decent number in a time when there are so many webinars happening all the time. So in fact, we often talk of webinar fatigue these days, but it's really heartwarming to see a good participation in today's webinar on something that is so close to our hearts and to all of us. It matters to all of us. So some quick opening remarks. Why OXfam? Because when Amita came to me with this suggestion of collaborating with the bioethics conference organizers to do this post-conference webinar, my first question to her was that, I mean, this audience is so different, but as OXfam, we, work a lot with communities, we work with other civil society organizations, but a conference on medical bioethics seemed to be a very, very, I would say, an interesting new space to engage with. And that's why I agreed with Amita that let's do this post-conference webinar. It gives us an opportunity to reach out to a very different set of players. And together, we hope that we can make a difference and maybe impress upon the policymakers to relook at this proposed law of increasing the age of marriage for women from 18 to 21. Now, the task force that is headed by Dr. Jaya Jaitley was supposed to give its report by 31st July. The report is still not, as far as we know, is not submitted. There is no information on the report in the public domain. But the moment we heard about this announcement made by the Prime Minister, Honorable Prime Minister, on 15th of August, if I'm not mistaken, we were quite concerned about this issue. The terms of reference of the task force was to recommend this increase in age of marriage to delay motherhood, to improve nutrition, and to increase the maternal mortality rate. Now, the National Family Health Survey data is constantly telling us that what we used to earlier talk about child marriage, that has shown a long-term declining trend. So, there are much fewer marriages happening below the age of 15, but we still have marriages happening between the age of 15 and 18. And the Prevention of Child Marriage Act is supposed to address that issue. There is already a law in place that is supposed to check child marriage in our country, and we all know how effective or ineffective that law has been. Introducing another law to so-called improve nutrition and decrease maternal mortality rate and delayed motherhood is, in our view, is not the answer to the issue. The reason for early marriage in our country really rests with social norms. And the social norms are mostly tied around the honor of the family, the fear of sexual abuse and violence, the fear that the girls will elope and get married outside caste, outside religion. So it's really about trying to control, we believe, the sexuality of women. And now increasingly we are finding the tendency to introduce ways to so-called protect women and girls by multiple ways of introducing apps and surveillance. But we don't think that's the solution. The solution really, and the reason for early marriage, lies in poverty. The poor nutrition lies in poverty, and poor access to education. Clearly data is showing us that there's a direct positive correlation between education levels and marriage age. So why not invest in ensuring that girls are able to access education and are able to join the workforce, have better agency over their own sexuality and body, is what, as OXfam India, we believe. And our current campaign, under the umbrella of our campaign called Bano Nahi Soch, which has become the new thought, is called Empowerment Not Age. And under that campaign, we are doing this webinar as well today. So with that, our ask really is to policymakers: please invest in poverty reduction efforts. Please invest in creating more skilling and employment opportunities, and education, making education accessible to girls, and especially girls and women from most marginalized backgrounds. Oxfam is committed to the issues of the most vulnerable and marginalized communities, from the Dalits, Muslims, and Adivasi communities in particular. And we believe that this investment is what is required to check early marriage, rather than passing another law which will criminalize marriage and really make life difficult for a large number of mostly poor families. So with that, I'm really happy to invite our first panelist, Ms. Shireen Jijiboy. Shireen is currently the director of, she's a demographer and social scientist with over 35 years of research and evaluation experience in areas of young people's health and development, women's empowerment, gender-based violence, sexual and reproductive health. She's also the founder and director of Akshara Center for Equity and Well-Being, a nonprofit organization dedicated to enhancing and evidence and evaluating promises in her research area. She's the vice president of International Union for Scientific Study of Population, and is a member of governing boards of Plan India, Tata Institute of Social Sciences, International Institute for Population Studies, and the Population Foundation of India. So with that amazing body of experience and work, we look forward to hearing Shireen talk about the topic of increasing the minimum age of marriage, its feasibility and desirability. She will talk about what the data is showing us on early marriages, what has worked, what has not worked, and will a law work, and what has happened in the COVID context. So Shireen, over to you, and you have 15 minutes to make your points. Thank you.
Okay, thank you. All right. So thank you, Ranu. Thank you, Oxfam, for inviting me. And thank you for your kind words. You couldn't have had this meeting at an earlier or more appropriate moment, because according to the print of today, this report has been submitted to the Prime Minister. And although we only have the print's presentation of it, I have tried to incorporate some of that into my presentation. So please let me apologize if my presentation is disjointed, because I've been trying to insert some of these new things that I learned today into it. Okay, so let's start.
Make it full screen, yeah.
Oh, full screen, yes. Thank you. Okay, so let's start.
Before you start, I just want to tell you, I'll give you a heads up at when 2 minutes are left. Yeah?
Sure, thank you.
Yeah, thank you.
Oh. Okay, so as you know, the Prime Minister has called for a task force to raise the minimum legal age of marriage from 18 to 21. The rationale is to lower maternal mortality, improve nutrition levels, improve opportunities for further education. And today's The Print has submitted its report, reports that it's submitted its report. And it's apparently the task force is recommending an increase. That's no surprise. But it says in a phased manner. And what phased manner means is that it should, states should be given enough space and time to do the groundwork. I'm not sure what all this means. But anyway, so is this rhetoric or is this based on evidence? How feasible are these planned recommendations? And how likely would it be to change the law? So let's talk now about how feasible it is. Let's look at a sort of historical perspective on what is the child marriage situation in India. As you know, this is the indicator that's most solid, the percentage of young women aged 20 to 24 who married below age 18. We have a lot of different indicators, but this is the one that's universally used, including in the SDGs. So what you see is that from the early 1990s to the mid 2000s, there was a very gradual decline in the proportion of girls marrying below age 18. And then there was quite a sharp decline from 47 to 27, so 20 percentage points. But still, this means that even in 2015-16, 1 in 4 girls is marrying below age 18, and that suggests a huge number of girls in this age group. But what's happened after 2015-16? You know that NFHS 5 has been conducted in a few states. The reports have, not the reports, but the fact sheets are out. And so taking from those fact sheets and previous reports, what I can say is that in the period, yes, in all these states where marriage age has been relatively low, there was quite an impressive decline in the earlier period, but now, as you notice, in this latter period, granted it's just 4 years, is relatively negligible. And for most cases, it's about 0 or 2%. Look at West Bengal, it was 41.6, it's still 41.6. So there hasn't been much of a decline. And then, how seriously have we taken the PCMA? If you look at the NCRB data, you'll see, or at least I saw, that only 525 cases were registered in 2019. And in these states with high child marriage, very few were registered. So we're not doing a very good job of registering our complaints. And what would it involve to increase the legal age of marriage to 21? Well, if we look at 2015-16, 63% of young women had married below age 21. So how realistic is it that a law can change the behavior of more than 3 in 5 families with daughters of marriageable age when it has failed to eliminate child marriage, that is those below age 18? It seems to me a fairly impossible task. So wouldn't it be more feasible to concentrate on reducing child marriage, for which the health and rights rationale is so strong? So let's turn now to how effective is this law likely to be. So today's The Print says, the task force has said that the age of a woman at the time of her first childbirth should be 21 years. The report says evidence shows that delay in marriage has positive economic, social, and health effects. Then it says, while the risk of poor child health outcomes is the lowest for women who have their first birth between 27 and 29, the broad range is 21 to 35. Are these assertions evidence-based? I could not find the literature, but we'll have to wait for the report. Maybe that will shed some light. So let's look at the maternal or infant-child mortality rationale. Globally, because we can't get age-specific data in India, but globally and in many other countries, those giving birth at age 15, that is, those who are marrying below age 18, those who marry below age 18, presumably, experience high levels of maternal mortality. But those aged 20 to 24, presumably those marrying at ages 18 and above, experience the lowest levels of maternal mortality. And then if you look at the child mortality numbers, and for that we do have data, and this is from NFHS 4, you see here in this table that those aged 20 to 29 had by far the lowest ages, the lowest mortality rates. And those aged below 20 had among the highest, as high as among the 40 to, second highest to those 40 to 49. So what does it mean? Denying girls the right to become pregnant in their early 20s would deny them pregnancy at the safest possible ages. The task force seems to agree that giving birth at 21 is safe. But then it doesn't make sense to restrict marriage to age 21, since typically the interval from marriage to first birth is about 15 to 18 months, denying this age the right to become pregnant. So it doesn't make a whole lot of sense. And then look at the argument about raising age at marriage to empower girls. We know, and there's no denying, that girls whose marriage is delayed are better off than child brides. They are better educated, better skilled, better nourished, better equipped to exercise voice, and so on. But these outcomes cannot be attributed to their increased age at marriage. Basically, they reflect the fundamental inequities that exist in our society, and I think Ranu pointed that out very clearly. So you cannot compare the two. It's like comparing apples and oranges. Late marriers have grown up with far more advantages than child brides. Mary John, for example, has shown so well that almost half of those belonging to the poorest households married in childhood, compared to just 1 in 10 of those belonging to the wealthiest households. Similarly, half of those with no education, compared to just 4% of those who had completed secondary education, had married in childhood. Child nutrition also reflects on wealth status and education more than it does on age at marriage. So this argument is not very evidence-based. And then the suggestion is, or the evidence really is, that it's not this way of the relationship. It's not increased age at marriage that causes better education, but rather the opposite. Education results in increased age at marriage. And I'm not going to go through these two examples, But just to say that both census decomposition exercises and longitudinal data have supported this view. So there goes the empowerment argument. Can a law change traditional norms? Marriage decisions in India are so guided by the gender stratified social system. What is most important then is to change patriarchal norms, social norms, as Ranu said. And instituting a law cannot really do that. Marriage in India is intrinsically bound with norms that dictate the importance of family arranged marriage, the right age, the right alliance, and deviating or exercising voice can lead to honor killings and love jihad at the worst, and huge criticism at the best. And so just read this narrative from a woman I interviewed last year in Rajasthan, who very chillingly brings out this, okay, it may be a view held by relatively few, but it's a view that's held. Our society will keep passing comments. If a girl goes off with a boy, if she does galat kaam, she won't be allowed back home. They will kill her. This is happening among us. Why don't we? That's why we don't send the girls out. That's why we arrange their marriage early. This concept of family izzat is so overpowering that it's really only those systemic education and so on that can affect it, and not simply changing a law. And then we have COVID. So what do we know about COVID? What we know really comes from what is known about the situation in other situations of crisis, disasters, and so on. We know that, parents use child marriage as a strategy to reduce poverty during crisis times. They marry off their daughters. Marriage costs are less, sometimes dowry is less. And so we'll be seeing possibly a spurt in early and child marriage. And this has already been seen in helpline data and some newspaper articles. So what's the point of raising the law when you know that, of raising the age when you know that what you should be tackling is the negative effects of COVID-19. And then there's an indirect effect through education. We know now that girls most affected by limited, are much more affected than boys by limited access to appropriate devices for online schooling. In a setting where resources are limited and devices are limited, it will be the boy rather than the girl who gets the device. And so her schooling is affected. When her schooling is affected, is she likely to go back to school, to want to go back to school? Many parents may not want to send her back to school. And so even globally, it's estimated that many girls are going to continue their education, are going to discontinue their education once school reopens. And being out of school, we have seen, leads to premature marriage. So there's an indirect effect.
Shireen, I'm assuming now you are at the last slide.
Okay, almost.
Yeah.
And so what works? I'm not going to go through these, but just to say, keeping girls in school and ensuring that all complete secondary school, offering different kinds of cash transfer programs, supplementary education, and so on, are very useful. Sensitizing parents, families, and influential community leaders about new norms. And if building awareness of the law is important, then I think much more important than a harsh law would be to deal sensitively with likely violators. So in short, it's not feasible, it's not going to be effective. The task force's recommendations don't seem to be evidence-based, somewhat contradictory, somewhat ambiguous, and raise fears in my mind at least. Rather, let us invest in better known strategies to raise marriage age that respect girls' rights. And let's try and meet India's commitment to achieving SDG 5. Sorry if I took too much time. Thanks.
No, you were fantastic. You were spot on. And thank you for such a crisp presentation, Shireen. So moving on to the next panelist, my pleasure to invite Dr. Sylvia Karpagam. Dr. Karpagam is a public health doctor and researcher working on the social determinants of health, specifically caste and nutrition. She works mainly with urban vulnerable communities, and she has worked closely with organizations and groups across the country. She has a huge body of work in terms of academic writing and research, with many peer-reviewed research publications in her repertoire. Her focus has been public and adolescent health, intersection of public and adolescent health, gender and caste. And Dr. Karpagam, that's of special interest to OXfam. We focus on discrimination. And she also runs a blog where she discusses global and Indian health systems in relation to policy, caste, and gender-based discrimination in the context of access to health facilities, among other issues. Today, Sylvia will be talking on social determinants of maternal health and age of marriage. So over to you, Sylvia, and you have 15 minutes starting now. And as in case of Shireen, I'll give you a heads up 2 minutes before you have to finish. Yeah, thanks.
Thank you. I hope my screen is visible.
Yes, it is. Yeah.
Okay. So I want to start off by saying that this is a really important discussion, and hats off to the team for actually engaging with it. And what we are seeing is that this is not actually a new phenomenon. For multiple issues, the government has consistently tried to lay the blame on women. Basically, anything that takes the focus away from the government and its responsibilities, and then placing it at the doorstep of women. For example, in the case of child stunting or child undernutrition, child mortality, open defecation, poor sanitation, anemia, sexually transmitted diseases, even rapes and sexual harassment, women have been held responsible for their own social or health related problems. And even when women die for whatever reason, either because of rape or as the process of maternal mortality, it's always laid at their doorstep, as they should have taken more care. And I think some statistics have already been presented. Specifically, I think this was discussed in the context of education of women, the female population 6 years and above. It has increased from 70.7 to 73. But if you see the breakup, it's only 67% in rural areas. And we also have women with 10 or more years of schooling is only 56.5%, and this is 42% in rural areas. And we know that the more women are educated, the more likely they are to have better health outcomes, maternity outcomes. And it's definitely as the woman gets more and more educated, not only the age of marriage increases, but also in terms of outcomes of pregnancy and limiting the family size. All of those are positively affected by a woman's education. And we see the reasons why girls drop out of school. It's like they're very shocking reasons. It's long distances, lack of public transport, And now in the context of COVID, the schools have shut down, the Anganwadis have shut down, and older girls are having to take care of the younger siblings. Mother's ill health or mother's death is definitely associated with girls dropping out of school and taking on the burden and family responsibilities. You also have financial reasons, and especially now with the kind of distress migration of families and this unplanned lockdown, which is, it has been a disaster in terms of people's livelihood. It's definitely reasons that you can't blame women or girls for this. It's definitely the responsibility of the government, and you would not hear a government, however proactive, coming forward and saying these are the things we're going to do to ensure that girls have access to a decent education. We're not asking for like some high-end fancy kind of education for children, but the pathetic condition of schools, especially in rural areas, there's a culture of silence around it by the government, almost as though it's a norm for government schools to be bad. And we also have girls who don't have access to water in school, who don't have access to sanitary napkins. I think anyone with even a little understanding of menstrual hygiene would understand that for a young girl to travel long distances from a home and go to school and not have access the whole day to water or to any facility to change her sanitary napkins, it's a disaster. I mean, why would such a girl go to school? And it is a big reason for girls dropping out. And the other statistic, which I think is just for us to be aware of, is that only 35% women have ever used the internet. And this kind of also links with the larger kind of structural effort to control, limit women's agencies and women access to information. We also have a reduction in the total fertility rate from 1.8 in NFHS 4 to 1.7 in NFHS 5. So basically, women, in spite of all the barriers, are still limiting their family sizes. And the women between 15 and 19 who were pregnant at the time of NFHS 5 has dropped from 7.8 to 5.4. And I don't think the government can really take credit for this. And it's like I said, it's in spite of barriers, women are still continuing to reduce or increase the age that they're getting pregnant. I think it was mentioned earlier that there is a lower mortality in the age group of 20 to 29. And this is definitely because educated women tend to delay pregnancy and tend to delay their age of marriage. So we also have only 68.7% of women who have access to any kind of family planning. So even if a woman wants to limit her family size, basically accessibility is a problem. So again, the woman can't be blamed if she has more children, or if she's her family size is more than what the government wants her to have. And if you look at the female sterilization, it's 57.4%. And male sterilization is 0%. And this has been consistent over the last several years. And the reason, again, is that women don't want the men to, undergo vasectomy and lose his virility or whatever it is. But the thing is, when most decisions in the family are being made by men, it's surprising why this particular decision is, so readily accepted, as women don't want the men to undergo vasectomy. And it again throws a spotlight on the kind of patriarchy, not just within society, but within the health system itself. And more statistics, which I think are relevant, is that only 70.9% women have had at least 4 antenatal visits. And here again, it throws a spotlight on the kind of health services currently operating in the country. And I think that was very stark and very evident during the COVID pandemic, and particularly the lockdown. a tendency to centralize and corporatize and commercialize healthcare, a very male-dominated, doctor-driven kind of a healthcare system, and very women-unfriendly, a very judgmental, top-down kind of a healthcare system, and absolute breakdown of the primary healthcare facilities. So for a woman, even for basic reproductive healthcare, has to travel long distances, and the further she travels away from home, the more she spends out of pocket and the less likely she is to access healthcare services. So basically, the closer a health service is to a woman, the more likely she is to access it. And I think coming from our own social backgrounds, we can understand this, that for women to travel further and further away means lesser and lesser access. There's also an average out-of-pocket expenditure in public health facilities of 4,954 rupees, and this wasn't even assessed or estimated for private health facilities. So other studies have shown that it's anywhere between 10,000 to a lakh. Again, a very daunting reason for women not to access healthcare facilities. And 52% of the births in private healthcare facilities were by cesarean section, as opposed to around 22.6% in public facilities. And this is important because if you see in the next slide, we see that there is low breastfeeding, and it's very normal for people to just blame the women and say, oh, she doesn't want to feed her child or breastfeed her child. But if 54% of the surgeries are happening as cesarean sections of the deliveries, then obviously she's not going to be able to breastfeed her child in the first hour after delivery. So the statistics have actually dropped.
We've lost you. We can't hear you, Sylvia.
Can you hear me now?
Now we can. And can you wind up in another 3 minutes or so, please? 3 to 4 minutes.
Oh, is it only 15 minutes?
Yeah.
Oh, okay.
And I can see you have 21 slides, so you'll need to really skip
okay,
a few
fine.
slides and
So the low breastfeeding rates again being attributed to women is unfair, and so there are other indicators. So I can share the PowerPoint, which again shows that the nutritional indicators are very pathetic in the country. And in Karnataka, instead of addressing the nutrition related problems, the government has actually refused to give eggs in the midday meals. It has stopped giving milk powder to pregnant women and Anganwadis, and has also brought in an ordinance banning the slaughter of cows. So if you look at it in a larger context, you can see that most of the decisions or the laws passed by the government actually anti-minority, anti-Dalit, and anti-Adivasi, and definitely anti-women. And women from these groups are particularly affected and almost targeted by the government. Again, like what we're seeing is, especially in the context of reproductive tract infections, sexually transmitted infections, and other reproductive diseases, the women can break her silence only when she is married. So, of course, marriage is not a solution to addressing these health issues, but it's also important for us to understand that it delays the period. If you make the age of marriage 21 years, it means women are less likely to be able to talk about any of these issues that affect them till they are actually married at 21 years. And we've also seen that the kind of violence faced by Dalit women and girls, it's not an isolated incident of caste or gender-based violence. It's very structural and it's very systemic. And in that context, marriage is sometimes only seen as a way out. And we hardly hear the government saying that we are going to address all these barriers to a woman because of which she is forced to get married, or because of which the family kind of forces her to get married. So there's very little effort by the government to actually address some of these issues. And also, we have visited shelter homes in Karnataka, and we've seen that there's incarceration of men in prisons and women in shelter homes, even if they are, say, 18 years, because they've had intercaste marriages or interreligious marriages, or marriage out of the kind of rigid heterosexual framework, and they have been put into these shelter homes. And increasing the age of marriage is only going to further put these women at risk, because the only reason they are put into these shelter homes is because they're called as minors, and the family says she's a minor and she's had this marriage and therefore she needs to be put into a shelter home. The men, of course, are put into prisons. Yeah, so with this new law, we can only expect more incarceration of so-called minor girls in shelter homes for breaking stereotypes, more parents, boyfriends, and husbands being arrested, and more likely to be from Dalit, Adivasi, and minority communities. And again, we have these ridiculous laws like the love jihad, which is only intent is to incarcerate Muslim men and harass the Muslim community. We cannot expect any change in maternal mortality, but only an increase. Also, the access to reproductive services is going to get worse, which can lead to further complications during pregnancy and longer period of stigma for sexually active young women. And more tools for the family and society to wield control over women's body. And lastly, I would say that what the government should actually be doing is increase the access to good quality free education, improve livelihood options, provide nutrition that is culturally relevant, make police stations gender sensitive, public spaces safe for women, increase safe public transport, increase access to safe drinking water, address rampant caste and gender-based discrimination, punish sexual offenders no matter how high in power hierarchy they may be, and create safe spaces for women to articulate their problems. If the government did this much and stayed out of people's eating habits and personal choices, then I think pretty much we would be sorted in terms of women's rights.
Thank you. Thank you so much, Sylvia. That was a very, very interesting presentation. And Amita, I hope that we will be sharing all the presentations with people who have registered for this webinar. So because I realized that you had to skip some very interesting slides to stick to the time limit, but we will be, I think, hopefully sharing the presentations. Next, I would like to invite, and this is a joint presentation being made by Mr. Vasudev Sharma and Mr. Thanga Perumal Pondapandian. Mr. Vasudev Sharma is the executive director and one of the founders of Child Rights Trust. This is an organization that's working towards upholding every right of every child. He has worked with NGOs, government and international organizations and universities, engaging in research and advocacy to spread awareness on child rights and their implementation. And he has served on the Bengaluru District Child Welfare Committee and Karnataka State Commission for Protection of Child Rights, and has handled cases with respect to child rights violations. Mr. Sharma has authored several articles and books on various child rights issues like juvenile justice, POCSO, prohibition of child marriages, etc. He's also the recipient of Karnataka State's Child Welfare Award. Mr. Pondapandian is a development professional with around 20 years of rich and varied experience. He has been working in the areas of child rights protection, disability, microfinance, education, health, livelihood promotion, and disaster management. For the last 15 years, he's been part of the Terre de Homes, Netherlands, and he has been managing programs in India, Nepal, and Sri Lanka. The intervention, he's currently also, he's involved, of course, in usual management roles of project planning and effective implementation of projects. He's currently leading the program of TDH Netherlands in India and in Nepal by empowering children, families, and communities engaging with government and private sector. I invite both of you to make a presentation on the ground realities of early marriage and making early marriages void, perspectives from Karnataka. I think we will, because there are two presenters, we will give you 10 minutes each, so a total of 20 minutes. Thank you. Over to you.
Thank you, Renu. Thanks for the opportunity to share what we are experiencing on a day-to-day basis. Probably the presentation by Shireen as well as by Sylvia has prepared a fantastic ground for us to tell stories about what's happening on the ground with respect to child marriages or early marriages. And also, while answering this question of whether the age at marriage needs to be raised or not. Recently, after the Prime Minister's announcement, etc., we had a consultation, and we are all of the opinion that it is a wrong idea to raise the age, but to put all resources in providing opportunities for girls to continue their education and to get themselves empowered. If there is any new law to raise the age of marriage, it will only create more criminals, unfortunately. That means more jails, more imprisonments, and more court procedures, and more girls will be in distress. So we are of the opinion that Prime Minister, kindly don't raise the age, but provide more opportunities. Well, to share these ground realities, we rely on our field experiences. One is our friends have already shared about several ground realities. We accept it. We go take it. If you look at the pan Karnataka phenomenon, the child marriages are visible. Our friend just now Shireen shared the data. In the last 5 years, there is no reduction of child marriages. And but the NGOs are quite active in campaigning, in preventing child marriages. There is a rise in reportage, a very good, a positive move. Childline 10 and 8, DCPUs, Karnataka State Commission for Protection of Child Rights, and the Prohibition of Child Marriage Cell in Government of Karnataka are receiving more and more complaints because of the publicity given to the whole the crime of child marriages. Media is writing a lot, thanks to them. There are editorials about why they have to prevent child marriages. And there is a growing movement of early married girls. And of course, in the COVID-19, just now Sylvia mentioned, COVID-19 has created a situation of increased child marriages. There is more reportage. Coming to the realities, well, we all know registration is not happening. One is the so-called proper age marriages is not getting registered, and forget the child marriages. We insist that all marriages should be registered, but it is not happening. Next, at the ground, what we are facing is fake age proofs. Although government has said that your birth registration or school certificate or medical certificate with a parental affidavit are the only three proper or legitimate age proofs. We are getting fake or revisions of Aadhaar cards coming up and people accepting it. That we have been raising this question, and there is no proper responses coming from the government. You can have any number of theories at the top level, but when it comes to the ground, on the roots, nothing of such things work if we don't follow up. The family and health department is the biggest, according to us, is a stumbling block. The reason is almost all below 18 pregnancies, they are all recorded as above 18 pregnancies on the mother and child card. This is the biggest crime that is being done, the omission on the part of the team, and they are also being CMPOs, and they reporting to the government health department, that is the health department reporting that all are above 18 pregnancies. So the government gets relaxed. The linkages between below 18 and above 18, basically anemic adolescent girls, is not at all taken into consideration. Playing safe by officers, like they will not be questioned if there is a above 18 maternal mortality. If there is a below 18 maternal mortality, then the officers will be pulled up. So they try to play safe by recording above 18 for every pregnancy. Even our families are responsible for recording the age as above 18 because they think that they get a lot of benefits out of it. I'm so happy that Sylvia brought up this family planning issue. Literally, there is no family planning education at the ground level. Particularly the girls who are below 18, if they are child marriage, whatever it may be, even the girls nor the boys are taught anything about family planning method. If you go and talk about usage of condoms or usage of tablets, it's a taboo. Nobody talks about it. Families think that you are creating a kind of a flutter in the families like that. Even in terms of options, it is not in the hands of the girls. Even if the girl wants her husband to use condom, it is not her option. Decisions she cannot make. You all know that somebody, I think Shirin mentioned it, schools get distance. You will not get higher education. That is, high schools are nowhere to be seen near the villages. And of course, with the child marriages, most of our girls are experiencing domestic violence, which is an accepted norm, almost. And then hundreds of divorces. In fact, it is not legal divorce, it is just desertions, and quite a large number of widows. And of course, second and third marriages, even these girls would have been the victims of second and third marriages. These are some of the ground realities. There are a lot of issues to talk about why child marriages, why early marriages. We have also brought in other aspects like we find that there are not many brides available in the villages. People talk about it. People talk about it in public, and they say that if the marriages are delayed, our boys won't get brides. So reserve them. Reservation is becoming a big issue. Second element that we have found very clearly is that why do you want a young girl in your family as a bahu, as a sase, or as a daughter-in-law is because of free child labor. She's a free labor. She does everything. She doesn't question. So that means that you want a child laborer. A lot of fear factors in the families, because I think that elopement, because even though there are about only 2-3 elopement cases in a year, they think that every girl elope and they catch hold of them and get them married. Of course, property, customs and beliefs, and having control over the families, these are all some of the reasons even today that is happening. And lack of transportation to reach high schools is another reason why girls are getting pushed into marriage. And believe me, government may question me later, but I'm telling you, there is no real law enforcement mechanism at the ground level. There are CMPOs, child marriage prohibition officers, but we don't see them in reality forcing and implementing the law. Now, may I request Thangam to take over here, and then we'll come back.
Yeah, thank you, Vasuji. Yeah, probably I think it's the right time to bring in our experience from the ground. Two things I just wanted to mention what Vasuji has mentioned. One, the health and family departments, the software will not accept the pregnancy, the age at pregnancy less than 19 years old. So he mentioned 18. Actually, the system does not accept anything less than 19 years old. So that's I just wanted to mention. And the second, the reason for marriages, early to get married is easy to find boys. If it is later, and then it is difficult for the parents to find boys for their girls. That's also one of the common reasons mentioned from our field experience. So here I bring in the experience of a particular program that we are implementing in the state of Karnataka. It's called IMAGE. It's Initiative for Married Adolescent Girls Empowerment. As Terrazome, as an organization, we work extensively on preventing child marriages. But in 2017, we were questioned by a group of young girls. Those are already married, but still they were children. Okay, fine. I mean, what are you going to do for us now? We are married. So then we initiated an action research. We worked with them for 3 years, 2018 to 2020, with 3,077 selected early married adolescent girls. So it has actually gave us an enormous learning and a huge knowledge bank actually. So we had a lot of interventions. I mean, still that interventions are going on under 5 different packages. Education, if they are
Anga, are
in the
you
school
moving
going
your
age,
slides?
or
Because the slide is frozen. Yeah, okay.
Yeah, slides are
okay,
not.
yeah.
Let him finish and then I'll come back to the other slides.
Yeah.
Yes, yeah. So the education, skill building, then health and nutrition, social protection, gender-based violence, economic empowerment. So these are all the 5 areas of interventions that we had done. So the main learnings are, it's not just enough to work with the adolescent girls to prevent marriages, early marriages or forced marriages. You have to work with men and boys. So that is actually a big eye opening, and we had to adjust a lot of our activities to include men and boys into our program. And the second, not just working with the girls alone will solve the problem. We need to take up a systemic approach, which is working with the families, the communities, the religious leaders, the government, the civil society organization. So that's actually the second part of it. So now we have taken up an approach to prevent child marriages, which is actually the girls themselves become an agents of change, because they have experienced, or they had experienced the problems of child marriages, and now they have or they are coming out to talk about these issues widely. So last one, are one of the successes, I would say that the government of Karnataka has formulated a committee to look into the issues of early married girls. And now it's actually the health department also agreed to record the right age of the girls when they get pregnant. So that's also one of our advocacy successes. So in this line, series of discussions taking place amongst us. So again, Mr. Vasu will be highlighting in the upcoming slides. So thank you. I hand back over to Vasu, sir.
Thank you, Tangam. As Sylvia Madam was sharing from the NFHS, in Karnataka, it has not really come down in the last 5 years. Child marriage rate has not come down at all. We have been talking about the previous 10, 15 years, but what's happening in the last 5 years is not really progressing. Now, as per the Karnataka government information, in the last 9 months from February to September, the government of Karnataka shares that 1,836 proposals for child marriages have been prevented, and 162 marriages have happened, and 84 FIRs are filed. This happened because of the civil society's pressure on the government to reveal what's happening, let us know about it. In terms of the situation of child marriages, government is conducting now open reviews with non-governmental organizations as well as with other stakeholders in the government. We have been pushing the government. When I use the word we, it is several NGOs coming together and pushing the government to talk about age-at marriage, age-at first pregnancy, and maternal mortality in different forums. Government has formed, Women and Child Development has formed a committee to look into the situation of early married girls. When Tangam was mentioning about image, when we first spoke about that we are going to organize the early married girls and conduct a program with them to empower, a lot of criticism we had to face. People even went to the extent of telling that you are going to encourage child marriages. But our strategy was to organize these married girls, record their experiences, and they becoming harikar, or they becoming ambassadors to prevent child marriages. It is working actually. Our girls are moving around, meet young girls and families and tell them about the miseries of child marriages, and they are working towards preventing the child marriages. What happened is, when we took this learning to the government, initially there was refusal, like in all other issues. But later, when we showed them about records, documents of these 3,000 and odd girls from 5 districts, government accepted to form a committee to look into it. Myself and Ms. Nina Nayak, we are members in this committee. And the committee met along with the secretary to government, met the EMGs, and they have agreed to study about the situation of early married girls and to impress upon the other departments. So we have started a study on this, but unfortunately because of COVID, it has been prevented. Hopefully next year we can take it up. The big point, all over India, people are asking us, wow, you have passed an act, void ab initio, so it must be creating history. But unfortunately, no, we don't have any clarity about it. We really don't know how void ab initio is going to work. Very little legal discussions are done, and very little or no tests have been done. There is no public education and dissemination. We have been asking the government to talk about or give clarity about what is void ab initio. Unfortunately, there is no linkages, as Ms. Shireen was mentioning. Where is the evidence to raise the age of marriage? Similarly, there is no linkages discussed with malnourished girls or maternal mortality, age of motherhood, SRHR, and education empowerment or domestic violence. No, nothing is linked to this void ab initio. 2 slides more. What's happening again and again with a lot of organizations coming together in combating child marriages is good thing is that government of Karnataka has increased the CMPO base. Now, even the Anganwadi supervisors and Grama Panchayats PDOs, they are all CMPOs. But the wrong effect is, unfortunately, an Anganwadi supervisor who is not really empowered is a CMPO, and our CDPO, Child Development Project Officer, who is all empowered, they just transfer the responsibility to the supervisor who is really cannot do many things. Then we have at the CDPO, CDPO's Taluk level child protection officers, but they are too busy and they cannot respond. In terms of public education, there is something going on the All India Radio as well as on Doordarshan, some programs related to say no to child marriages. Civil society organizations are having regular movements, but very little impact. We have been trying to push the government to take this seriously. What we require is actually diversions and activities, meetings, information sharing, creating educational opportunities to girls. What we are insisting is have high schools at a short distance, within 5 kilometers, have high schools. And if it is not possible, provide hostel facilities to girls. That's what we have been asking. And image child children good, that is stopping Devdas's system, campaigning against child labor, KCO. Some of these people are working to act as eyes and ears. The last slide here is we are asking for revising the child marriage prohibition Karnataka rules 2015 to suit the changing developments. The biggest development is 2017 amendment, void ab initio and others. We need that to be brought into the Karnataka rules, as well as the amendment to IPC 375 provision, which has been scrapped, that we need to bring into the rules. Then in terms of filing FIRs and POXO are sometimes just talks. As per the law now, all child marriages are void ab initio. But what is going to happen to the girl? It is not clear. And who is going to file a case in the police stations under POXO or others? We don't know who has to do it. So what we are looking at is linking child marriages and other development indicators, malnutrition, MMR, IMR at the panchayat level, That's a big demand that we are asking. These married girls are now growing up into ambassadors. They are working around. Our current demand is to include child marriage issues into the curriculum of primary school and high school textbooks. It is not just a printed material on the wrapper, but it should be part of a lesson, in terms of prevention, in terms of empowerment, that we are demanding. Right now, in the COVID, we are expecting some changes. Hopefully, in the post-COVID situation, our girls will be safe. Thank you.
Thank you. Thank you very much, Vasudeva and Thanga, for your presentation. And I would now like to invite our last panelist, my colleague Amita Pitre. A little bit about Amita. Amita is a development professional of close to 20 years of experience in gender and development. And she has worked in the fields of gender equality, women's rights, and gender-based violence. And she's also a Fulbright Nehru visit. She got the Fulbright Nehru Visiting Fellowship in Women's Studies, and she was at the Emory University in Atlanta. Amita leads the gender justice portfolio with OXfam India, is extremely passionate about issues of gender justice. And well, the rest you can hear her speak on this issue of age of consent and age of marriage, conflations and challenges. Over to you, Amita.
Thank you so much, Ranu. Very happy to hear all the panelists talk about the varied aspects of this issue. I'm going to add to some of it. So for the last about 2 months, we have been in an intensive campaign because what we first realized, though the task force was instituted in June itself, what initially seemed like a no-brainer, and you felt that the law cannot be a solution to an essentially social problem, but we felt that there is not enough understanding of what possibly harms this kind of move could have. So when we went into the social media and tried to talk to the youth, a lot of the questions came, okay, let the age of marriage be raised, let it be like a benign thing on the side, and let the civil society continue and the government continue with its other efforts to build an enabling environment. And that is when we thought, no, it is very important to talk about the other side also. As Shireen also mentioned, that there is a fear of witch hunting, there is a possibility of marriages going underground. Dr. Sylvia also spoke about incarceration of Dalit and Adivasi youth. Vasudev and Tangam also spoke about how girls are now being encouraged to hide the age of marriage and hide the age of pregnancy, thus increasing their vulnerability. So we thought that we should build on this dialogue to talk both about what enabling environment could actually achieve and what are the harms. And here I would like to talk a little bit about some work I did during my Fulbright fellowship, and then connecting it to the current issue at hand, which demonstrates what are the unintended consequences that laws could have. So one of the fears when the task force was instituted is that will the age of consent for sexual activity also be raised, just as the age of marriage is being raised. So since 1940, the age of consent has been 16 years for a long time. What the age of consent really means is the age at which a girl is considered eligible to give consent for sexual activity. So under that age, irrespective of what the girl says, it is going to be statutory rape. And above the age of 16, she is considered capable of giving consent. And for a long time, this worked and there was no problem seen until in 2012, the Protection of Children from Sexual Offences Act, the POCSO Act came, which actually filled the void of a useful legislation which we did not have against for sexual violence against children. So in many ways, it has been a very valuable law to have, but at the same time, it criminalized all sexual activity under the age of 18 years. So it used the whole idea of everyone is a child under the age of 18 years to legislate that therefore they have no agency or no understanding of sexual activity, and therefore cannot basically consent to sexual activity, thus making it. So here some linkages I can see right here is at 18, people are considered majors, and already we are thinking of taking some steps like increasing the age of marriage from 18 to 21. So already stepping into that area where do we really have the right to decide for those who are majors? But already this happened, and looking at the definition of a child, but without looking at the needs of children who are sexually active, say those who are between 15 to 18 years, we know that already 1 in 4 are also married. So there is this entire area where either in marriage or outside of marriage, young people are sexually active. And what basically criminalization does is deprive them of the rights and the security, the safety, especially the access to contraception, access to safe abortions, and those kinds of things which would really be needed to make sexuality safe for them. But basically, not just in 2012 when the POXO came, but in 2013, then the Indian Penal Code was amended so that the age of consent, which was defined under the IPC, has also been raised to 18 years. So this is the first time after a gap of so many years that it became apparent that really policymakers are looking at a simple law, such as the law itself is not simple, but a enactment of law seems to be like a very simple thing for the lawmakers, while its consequences for the people can be very disastrous. So for example, by raising the age of consent to 18 years, there's a simplistic thinking that this is going to eliminate all sexual violence faced by those under the age of 18 years. And we know that it has not happened like that at all. And then one of the earliest places where we see age of consent and age of marriage to be linked is right back to the 1890s, when the first Indian Penal Code was enacted in India by Macaulay in 1860. That was British India. The age of consent was 10 years. But then there has been a lot of those reformers who have been asking that no, the age of marriage. So these are two different concepts. One is the age of consent, which is for sexual activity, and the other is minimum age of marriage. So we are talking about an India where infant marriages also were very common, not just child marriages. We are now in a changed India where we are trying to actually tell people that we don't have so much a problem of child marriages as much as a problem of adolescent marriages, and we need to work accordingly. But in those days, it was actually very young age where children were getting married. And the death of Fulmoni Devi, a 10-year-old girl, which really precipitated this entire campaign that the age of marriage needs to be raised for girls just to save their lives and to save them from that kind of sanctioned sexual violence. And this is the first time that the social reformers encountered that the British are not really interested in interfering with the personal laws of the country, that is India, because they did not want to be labeled as that. They had kind of decided the inheritance and the religion and those things would stay separate. And that was when the social reformers actually came up with a proposal that why don't we instead increase the age of consent. And at that time there was no marital exception law in India. It was just the age of consent was 10 years. And that is the time they thought that this is a useful way of increasing the age of marriage. And that's how age of consent and age of marriage actually got linked for the first time. And then there was a lot of pressure built because a girl, 10-year-old girl, Fulmoni Devi, died due to an early marriage. And that was when these two things were used together to at least save some of the girls from early marriage. But today we are in an India which is very, very different. We thought between 1940 to 2012, the age of consent did not change at all. So we are now looking forward to more enabling conditions to improve the girls' well-being in life. And we've spoken about a lot of social norms and other factors which are the root causes, girls not being able to stay in school, girls not being able to get the care that they they wish to get and they need to get. And therefore, we will now come into an area where we will look at enabling conditions, but then we see that in the last 5 years, and not just that, also in the COVID period, a lot of child marriages were actually reported. So in the most periods of distress that people have, they have been actually they find themselves with lack of support, and there is a lot more precipitation of early marriages happening. But then in my research, I also saw a reference that was made in the 84th Law Commission report in 1980. And what does the report say? The question to be considered is whether, this is after the 1978 child marriage law was passed, which made the minimum age of marriage 18 years. The question to be, like after that 1978 law was in place, the question to be considered is whether the age of consent should be increased to 18 years. The minimum age of marriage now laid down by the law after 1978 is 18 years in females, and the relevant clause of section 375 should reflect this changed attitude. Since marriage with a girl below 18 years is prohibited, though it is not void as a matter of personal law, sexual intercourse with a girl below 18 years should also be prohibited. And they had actually recommended in 1980 that in section 375 you need to amend with or without her consent when she is under 18 years of age. This was not accepted, thankfully, at that time, but we can see that the seeds of those kinds of thinking, that a girl's sexuality needs to be only restricted within marriage. So if the age of marriage is raised to 18 years, how come you can have the age of consent at 16 years? In the 205th Law Commission report of India, also we find reference that Law Commission report was actually was making a proposal to amend the Prohibition of Child Marriage Act 2006 and allied laws. In there also you see the Delhi Commission of Women and National Commission of Women had asked for a uniform definition of a child across laws in the country to ensure uniformity and protection of children against sexual abuse, raising of the age of consent to 18 years and to bring it in conformity with the minimum age of marriage, and deletion of the exception to marital rape clause. So we see that intermittently there have always been calls to bring age of consent and age of marriage into parity. And this is where we cannot forget the unintended consequences of law. So when we look at the different across the courts studies that have been done looking at the profile of rape cases that have been filed in court, we find that there are between 18 to 54% of rape cases such that they are eventually thrown out of the court because the girl comes up and says that, no, I was engaged in a consensual relationship and I never filed for rape, but it is because my parents have either filed for rape because I'm under the age of 18 years, or that I have been presented as being under the age of 18 years. So the age of consent law is actually being used to criminalize unacceptable relationships, and these relationships invariably are intercaste and interfaith relationships. So here also you find the social norms of whom a girl ought to marry and how her sexuality needs to be expressed is actually coming together with the ideas of marriage. And similarly, what Dr. Sylvia was also alluding to is, why would Adivasi and Dalit youth, the girls being put into shelter homes and the boys being put into jails, is because these relationships are not acceptable to the parents who actually file these cases. So, and when we did our ground level assessment of how the Prohibition of Child Marriage Act works, and Madhu Mehra, her research of why girls elope, shows similar findings, that very often first the CMPOs, CDPOs are actually faced with these cases when there are cases of elopement, and they come to the child marriage prohibition officers to say, please stop these marriages because our young people are eloping. So basically we are thinking simplistically about some of these laws, how they are going to work in society. So there is a simplistic understanding that if you increase the age of marriage to 21 years, automatically the society is going to start functioning differently, is one understanding. And the other understanding is that increasing the age of consent is going to stop sexual violence in society. And both of these things from today's presentations we see do not hold as per what is expected. So we have to be really wary of looking at laws to solve some of the problems, social problems. And at the same time, when the task force reports were discussed, it has always been combined with fears of these two, that is this going to be a route to make all underage marriages void? That could be one track the government takes. And the other track is also, are they going to again bring up the question of age of consent and age of marriage together? And though it may not happen immediately, we need to guard against the slippery slope, because these things happen step by step. Initially in India, the age of marriage 2006 Act makes marriages voidable but not void. But it's only when that act has been in place, and now Karnataka, after that Haryana, there's also talk in Delhi that people have started thinking of making laws more and more aggressive. And that's why I just gave this example of the age of consent, the way it has worked. And the age of consent law has also been coupled with mandatory reporting. So this is another step on the slippery slope, that if and already from the medical community, from the gynecologists, we have seen that the medical community often makes this conflation of age of consent and age of marriage. For example, if an unmarried girl goes for a safe abortion, she asks for a medical termination of pregnancy, she's often either charged more if she's not married, or she's asked to get the signature of her husband and or her in-laws, and they're often exploited. So this whole understanding of lack of sexual rights outside of marriage is very problematic. And then when you have this mandatory reporting for sexuality, which is considered illegal or not not within the rights, so within the rights of young people, could either be under the age of 18 years because it is statutory rape, or it could be outside of marriage. And when these two concepts get linked, it can be very difficult for young people to actually access sexual and reproductive health rights. So to guard against this slippery slope, we really need to look at whether we need stronger laws of this kind to solve an essentially social problem. And only more discussions and debates are going to prepare us to basically critically analyze this issue. Otherwise, for the large majority, it might mean there cannot be any harm in this kind of move. So I rest my case over there, and so that's what we want to say here.
Yeah. Thank you, Amita. And Amita, I would like to now ask you to then handle the question. We can open the floor for questions. So please moderate that part. And Anushri, our colleague, has hopefully been, although I did see that there were not too many questions coming in the chat box, but maybe they have come now. So Anushri, maybe if you have the questions and you can tell Amita who they are directed to, then Amita can moderate that. And then I suppose we are running 15 minutes behind our schedule. So, but I think, I hope people can stay back for another 15-20 minutes. Because
yes,
what I see is that the questions and discussions were scheduled for from 5:15 till 5:45. So we are already at 5:30, but it's now over to you, Amita. Yeah.
Thank you so much, Ranu. We have a few questions. One I can see is from Professor Lakshmi Lingam, and she is asking Vasudev and Thangam, thanks for sharing your interesting work. In which districts is this happening? In the contiguous districts of Telangana and Karnataka, early marriages are also linked to drought conditions, high levels of family migration. Can you throw light on this?
Certainly, it's a reality. One is the drought. Second is migration. These are all major reasons for families getting into child marriages. For a long time, it was believed that it's only poverty, but poverty related to poverty because of other reasons or driving families to child marriages. For example, Bengaluru is supposed to be a metropolitan town, and people think that Bangalore is a developed city or a developed location. But if you look at the statistics, Bangalore ranks one of the highest, one of the towns having highest child marriages because of migration. You find a lot of North Indian families as well as families from North Karnataka staying in various locations, and child marriages are very common in these places. Just to give an example, I live in the outskirts of Bengaluru. A lot of construction activities are going on from quite some times there. You see that laborers coming from Bihar, Orissa, West Bengal, Rajasthan, Uttar Pradesh, young boys will be going around and working, well-built boys, 19, 20, 21 or so. Within 2-3 months, you find a young girl with them. They have come back with their bride. They're married because they see getting a girl is to cook for them. That's a reality. And as the person who has raised the question, people come in search of work, and whether it is because of drought or some other reason. And when the men are moving out to work as laborers, soon they also bring their maids, rather their wives, to work with them. Tangam, something to add?
Yeah, one thing, Professor Lakshmi Lingam, when the parents move from northern part of Karnataka to Hyderabad or to Bangalore, for them the another kind of burden is their adolescent daughters. So for them, taking the adolescent girls with them to the destination is again, it comes with the responsibility of, within the quote unquote, protecting these girls. So for that, they see getting them married as an easy solution, so that they are free to move to their destination. So that's actually a real situation, but it's a really sad situation. Thank you.
Thank you so much. We also have one more. I'm just going to read out. Anybody can take this question. When we are talking about child marriage, does it also include early marriage? Also, what about the young girls who are getting married consensually? Is it valid and accepted? That is a question. We know that the definition of child marriage is any marriage under the age of 18 years. So it does cover the evolving definition of early marriage, which is from 15 to 18 years mostly. So it is more appropriate to call it early marriage. But would anyone want to talk? I will also read one more question and we can take it together. Should age of marriage be made uniform by law when India's many cultures do not acknowledge the likely adverse impact of early marriage on maternal health? That's one question. This has been asked also in other forums, that should men and women have the same age of marriage, and why should men be quote unquote allowed to marry at 21 when girls' minimum age of marriage is 18 years? That's one question. And what are the actions governments can take to remove patriarchal norms? So maybe all of you can talk a little bit about this. And for the audience, please do also raise your hands if there are more questions. Yes.
Okay.
Kirin, would you like to take that? Yeah.
I can't remember all the questions you posed just now, but should we make a law on age at marriage given India's multiple cultures? Well, paramount should be the health and well-being and rights argument. And so in that sense, there is a rationale for something like 18. It's been universally established. Of course, surprisingly, the CRC has called for free and, sorry, I'm not sure of the right language, free and full choice in marriage partner and timing of marriage. And that nobody is talking about, although so many young people in this country, girls but also boys, are marrying really without any meaningful consent. So I think that's what we should be looking at as a package. Should men and women have the same age at marriage? Yes. But that doesn't mean we need to increase to 18 to 21. Why not think about, like many countries have done, keeping both at 18? We know that boys don't marry at 18. We know that, I think a handful, I'm sorry, I don't have the numbers, but a very small percentage are already marrying at 18, and that has nothing to do with any law. So I don't see any harm in thinking about reversing this law and talking about boys, and above all, consensual. Marriage should be consensual. Girls should know that they're getting married tomorrow. I can't tell you how many girls told me that they didn't know, they were getting dressed up and then they got married. So that's it.
Thank you so much. There was one more question, is what should governments be doing to address patriarchal norms?
You want me to take that?
Yes, if you would like to.
So as I think I answered, I think that was Prince.
Yes.
I said, you know, we have so few programs for parents. Ultimately, parents are the decision makers. Yet we talk about programs for empowering girls. Girls get empowered, but in the face of parents who oppose that, I think girls really have buckled, and not buckled, but they have no choice but to acquiesce. Girls say, well, they said they were, I think in Karnataka, this Young Lives study, girls said, you know, they told me I was going to get married. I didn't want to, but I know that I told my parents, if anything happens, it's your responsibility and you have to take care of me. If I had married out of my own choice, I would not have been able to say that to them. So we need to really address parents. And I think really that's a request to everyone. Can we do programming that makes sense for parents? We need to address gatekeepers. And we do have, at least technically, not gatekeeper, but we do have the mechanisms. We currently have SAGs, we currently have farmers forums, we currently have PRIs. PRIs are meant to be affecting social change. Here's a perfect opportunity. So I think we need to address the gatekeepers. And yes, others of you have talked about campaigns and so on. I think those are one-off things that, of course, they make a difference, but I don't know how sustained that information is. I think something repeated is probably more important than something that's one. Sorry.
Yeah. Thank you so much. We have one more question, and then I would request everyone to address that. Anubha Rastogi asks, wouldn't making registration compulsory and making child marriages void ab initio just push these marriages under the carpet, making the minor girl in this process even more vulnerable? What do the panelists opine in this move? So we have been talking exactly about those issues, but if anyone would like to comment on this, there is also one question specifically for Shireen. Is there any research globally to show raising age at marriage legally leads to better maternal health outcomes? This is from Anuradha Rajan. So,
not to my knowledge. We know that older girls have better maternal health outcomes. We know that maternal mortality is highest among the youngest. But whether it's because of a legal increase in age at marriage or whether it's just that older girls are better off, I don't know. So if you know of any, please pass them on to me. Thanks.
Thank you, Shireen. I wanted to ask Dr. Sylvia if she would like to talk a little bit about this. What would be the impact on the ground if all child early marriages were made compulsorily registered? That's what Anubha is asking, and made void ab initio right at the beginning, because you spoke about the impact on Dalit and Adivasi youth.
Thanks, Amita. I think this is like a catch-22 situation. So basically, increasing the age of marriage means all the relationships, whether through marriage or out of marriage, would go underground. The kind of sexual violence and harassment and abuse would increase. But the so most people don't register for that reason, because they are marrying like below the mandated age. And I mean, and as far as that point about maternal mortality is concerned, I think, like I said, we have such pathetic nutritional outcomes in our country, very poor nutritional indicators. We have, like, for example, in Karnataka, they don't give eggs, they don't give milk powder, and then now they've brought in an ordinance to ban beef. So on the one hand, the government is doing everything to increase the maternal mortality in the state and in the country. And then on the other hand, they're using that as a way to control women. So it's mischievous on several fronts. So it's I don't think the argument should be about whether they should be registered or not. I think what has to be understood is the intent of the government, and are they really serious? Are they really committed? And if they are, then there are several things that they can do, which they're clearly not doing. And blaming women and, you know, bringing all these regressive laws on women and their families, I don't think that's any way to go for these kind of social issues.
Thank you, Sylvia. I have one question generally for the panelists, and one particularly for Mr. Vasudev. But before I go on with my question, I have got one more from Dr. Meera Shiva. How much do you, this is for Shireen and myself, how much do you think international pressure, SDGs and other well-meaning persons wanting this law, who assume it will help the girls, the nuances and implications are really not understood? How much do you think is the international pressure that is driving these kinds of moves? And why is the Dowry Act still not being implemented, and Justice Verma committee recommendations to make it safer space for girls? So I would ask all of you to comment on this question, that how much do you think is the international pressure because of SDGs really moving this agenda? And I want to add another question of my own, is that there are some in the general middle class psyche, when especially girls are marrying at a later and later age, there is this whole idea that this move cannot be wrong. So if you think that the decisions are going to be made in the political arena, what is the narrative that would work to actually bring out the nuances of this issue, that raising the age of marriage to 21 may not necessarily be a good move? So to you, Shireen, and then also the other panelists. And to the audience, you can feel free to raise your hands to ask questions if you need to.
I'm going to give a very thoughtless answer. Yeah, Meera, your question is too difficult to answer and process in this short time. But I know SDG pressure is affecting government's acceleration on, some other in the education or so on front. I noticed that they're not tracking the marriage indicator as well. Maybe I'm wrong, maybe I saw it. So I don't know, is it that they've decided that we're not going to meet the SDGs, so why track it, why worry about it? Or is your question, do you think SDG pressure is making them raise the age at marriage? I don't think so, because we're not going to meet 18, so why would they be motivated to increase it to 21, even if there is SDG pressure? So that's one thought. Again, why is the Dowry Act still not implemented? Why are all these acts not implemented? We have beautiful acts in the writing, but the action is always a little behind or very behind. Thanks. Sorry for the funny response.
Thank you, Shireen Vasudev.
I think the whole concept of SDG goal number 5 is misunderstood by our government machinery. SDG is clearly telling that to reduce maternal mortality, look at the raising the age of first pregnancy. And with one stroke, you cannot say that all pregnancies will happen only after marriage, so raise the age of marriage. I mean, this is a wrong interpretation, what I feel. Secondly, when our finance minister spoke while presenting the budget in the parliament, she also mentioned that to raise the age of pregnancy, we are going to take up a program. Immediately, it was misinterpreted to say that the age of marriage will be raised. And unfortunately, why the Prime Minister made a statement like that on the Independence Day to say that we are going to raise the age of marriage. And immediately, there are so many people, almost like a cacophony, going behind him to say that yes, raise the age. Unfortunately, it is again looks like they're targeting to a particular community. It is not true. It should not be like that. So SDGs is largely, I feel, that is misunderstood by the both political leaders as well as some people in the administration. And by this we are sending wrong messages to the community. We are not giving the right message. The right message is, as we have all seen, even our researchers have shown, that provide educational opportunities. I second Shireen when she mentioned, as well as when Sylvia mentioned, and your question to say that with the higher educational levels, the age at marriage of girls is certainly going up. And as and when their marriage age is going up, certainly their pregnancy age is also going up. So we need to make more arrangements, invest more in the infrastructure related to education, protection, and probably providing skill-based education to girls as well as to boys. The concept of having a child within 1 year after marriage, that has to be erased from the mindset of the people. Nothing will happen if you have your first child after 3 years. That kind of education has to happen, particularly at the ground level. By, of course, we will go back to Anganwadi workers, we go back to ANMs, we go back to the local teachers, and they have to do it. And that's what I keep telling, that it has to enter into our curriculum at high school level, primary school level, at the college level. This has to be part of the curriculum. Then only we'll be in a position to send right messages. As your title says, right intentions, but wrong interpretations that we have to solve in the coming days.
Thank you. There is one more question from Prashanti. It says, in Eastern Ghats region, Adivasis follow consensual live-in relationships without getting into marriage, and a large number of girls between 14 to 17 and boys between 16 and 20 generally start living together. By the age of 25, they would have 5 to 8 children. Thankfully, ICDS and health workers are reaching them and providing services, including motivating them for institutional deliveries, in addition to supplementary nutrition, vaccination, etc. Despite of their deprivation to many basic facilities, though there were few infant deaths, in the past 1 year, things have been improving. What would be the response of the panelists to this? How should we consider this in the light of the new proposed act? I think it just shows how the act is completely divorced from the realities that we see on the ground level. But anybody wants to add more here, please do. Like, it is true that there are multiple kinds of relationships which we find in India, and in Adivasi areas also we find live-in relationships at very young ages. How would you look at it from the perspective of this act, this proposed possible increase in age of marriage? Dr. Sylvia, do you want to look at this, or anybody?
I think there's pretty much the panel discussion answered some of these points, and I think what we are all trying to say is that there are multiple things that the government can do, like increasing access to nutrition, to education, to healthcare services, vaccination, making it available closer to people, and definitely kind of addressing the whole patriarchy within the healthcare system, within the political system, and that culturally there are practices, and I think as long as these are not harmful to individuals, I think there should be some space allowed for cultural practices. In the sense, culture shouldn't interfere with women's agency and shouldn't be a way to control women's rights. But if it's not interfering, then these things can be facilitated or can be changed over time, rather than criminalizing entire communities and groups of people. And I think definitely that's the intent of the government, taking away the onus from all the things that the government can do. That's all I have to say.
Yeah, I agree, because adolescent sexuality is a reality in society. So we are only closing our eyes by not recognizing it. But if it doesn't have to end in 5 to 7 children or some such, then there is a lot that, like the Rashtriya Kishore Swasthya Karyakram is there, but it is mostly dormant, because the legal terrain, as we saw, is so difficult that doctors don't know whether they can offer a safe abortion or a contraception to someone who is under 18 years of age. So it is, until we resolve some of these issues, it is going to be difficult to do with the law. Over to you, Ranu. I think the questions seem to be over now.
Yes, and I think people are now wanting to leave also. We have overshot our time limit as well. So, Amita, I'm assuming that people who have registered, we can share the PPTs with them?
Yes, we can.
So you will be sharing the PPTs with everybody who is registered. So thank you once again to all the panelists, to all the participants. I can still see we went up to close to 90 participants at one point of time. We are now 58. And if I remove the OXfam and the panelists, and still 50 is not a bad number. As I said, in the age of webinar fatigue and for people to stay on for a full 2 hours. It really shows your passion and interest in the subject. So thank you all very much. We shall remain in touch with you and take these conversations forward. Have a nice evening. Bye. Bye, everybody.
Thank you, everybody. And special thanks to the Forum for Medical Ethics Society and the Yenepoya University, especially the Ethics Center, for making the National Bioethics Conference happen in such difficult times. This conference, for the first time I saw, went completely online, and for facilitating this meeting space for this webinar to happen. So thank you very much.
And I'd also like to thank our team, the other members of the team. Amita, you know best who all you need to thank. So please, I think it's good to mention the names.
Anushri, Asmita, Jahnavi, all have been working behind the scenes. And from the FMES also, there's Mahindra from Yenepoya University, there's Deepak, and there's Vijay from FMES. All of them really worked very hard to make this happen. So thank you very much.
So bye, everybody. Have a nice evening. See you.
Bye.
Yeah.
Bye.
Bye and thanks.
Thank you. Bye-bye.
Bye. Bye.